in our local language, Maluwa means flowers. So my name is Aaron Flowers. Fine. Briefly, I'm very excited with the what Phyllis is.
Your
Oh,
title.
okay.
Look this way.
And you
No,
can
no,
Yes,
write it for
yes,
us.
okay. All right. Aaron Maluwa is a Malawian. I'm working for the Museums of Malawi as a Director of Education Programs. Briefly, Phyllis and Malawi Matters are doing incredible job in Malawi, specifically because they have tried to narrow down where do we have the most needy communities. And this is a global analysis, and Africa is the most hit. And Africa, not the whole of it, but sub-Saharan Africa in particular, is worst hit. As you know, HIV/AIDS, in particular, it's about 3/4 of infected people are from sub-Saharan Africa. And Malawi is within. And coming down to Malawi, we have 15 million people plus, and over 1 million of them are HIV positive. And the further effects of having over 1 million people HIV positive, we also have over 1 million orphans. These are people who need support locally and globally. And the major analysis is that the main source of the transmission of HIV/AIDS is our cultural practices. Malawi, we have about over 11 major ethnic communities, and each ethnic community has its own cultural practices. Some of them have a major role to play in HIV/AIDS transmission. For example, like some ethnic communities, they encourage young children to go for initiation. And the most important education that they deliver is to talk about sex, adult life. And they encourage the children, the young girls, to have early sex with adults without HIV/AIDS test. And this has led to high infection to young girls, high early pregnancy rates, and high school dropouts. Parents don't have a major say to stop this because it's their cultural practice. They say this is how we've been trained to grow up. It's part of their life. And some ethnic communities also encourage polygamy. One man can have 3, 4, 5 wives, regardless of his or his financial status. And you never know who will catch the virus among the 5. And when one catches it, it spreads throughout the family. And when that spreads, each family in Malawi has generally more than 5 children. And if you can imagine 5 wives, for example, one father, if all of them catch the virus through one person who is unfaithful, it means they will leave maybe 20 orphans. This is happening in Malawi. And when you have such kind of orphans, they don't have means to support themselves, whether at home or even they don't have the means to support one another to go to school. And this is creating a vicious cycle of poverty. And Malawi will remain poor if we don't reverse the trend. So as a government institution, the Museums of Malawi mandated to promote and preserve Malawi's culture were strategically positioned to create awareness to the Malawian communities about the need to change these bad cultural practices, because culture is dynamic, it's not static. So we are trying to tell people that the cultural practices that we have enjoyed all over the time now have become dangerous because they're a vehicle for HIV/AIDS transmission. So we are saying, please, change these cultural practices. So we give examples how these cultural practices help to transmit the virus. And we are not saying we should condemn all our cultural practices. There are some cultural practices which are good, that can be used or that are being used to transmit positive change of life. And this is exactly what Phyllis is also doing. We are using music, which is a cultural practice, to spread the messages about HIV/AIDS transmission and prevention. We are using drama to communicate messages about HIV/AIDS transmission, the importance of testing, the importance of avoiding stigma and discrimination, and looking after others, what we call positive living, through drama. Songs in Malawi have a very powerful they're a very powerful source of information delivery. Songs are used to communicate about HIV/AIDS prevention, testing. Now, the museums of Malawi made a link with Phyllis because there were some commonalities. Phyllis is using culture. The museums of Malawi is also using culture to transmit HIV/AIDS prevention messages. And therefore, we worked together in 2010 as a pilot project, and then we had a full-time project in 7 presbyteries. And we were targeting school children, adolescents, and now the Christians. Not only Christians, I should say, all churches around each venue that we gathered. We brought them together, which is very unique. It doesn't happen in many communities to bring different people from different churches together and receive the messages. We did. And the results were very overwhelming. We had more than 48,000 people reached. We had over 23,000 people tested. They knew their status as a result of that program. And we had about 530 people referred to the hospital for medication because they turned out to be positive and they were in a worse situation. And therefore we said, this is the part that we can play. Because these people who knew their status through our programs, now their life changed. They were introduced to the hospital, they were introduced to the medication, and these people are alive now. Without that program, they should have been dead because they couldn't have known what is eating their bodies. So we think the Malawi Matters program and the museums of Malawi programs are life-saving programs. They're very important. And I would like to appeal to whoever has a listening ear, whoever has a source of resource to support Malawi Matters by providing whatever resource, be it financial, be it technical, or whatever means they can do to contribute towards the success of this program so that we reach more and more people and save more and more lives in the country.